All right, quick medical minute. A recent article came out discussing a lot of controversy within the ER field, but also internal medicine, family practice in terms of admission medicine. And it's the PESIT trial, PESIT. And basically, a study did look at all patients being admitted to a hospital for syncope and then working them up for pulmonary embolism, and found that 1 in 6 had indeed a pulmonary embolism. And that kind of like really make people crazy, thinking, okay, you know, this is a pretty large prevalence, and even if they're not tachycardic or hypoxic or everything else, 1 in 6 will end up having a PE. There's a lot of controversy because it's almost like a selection bias. Obviously, the people who got admitted were because they were high risk already. They were older, or they have history of cardiac disease, or they have history of atrial fibrillation, because most people who pass out don't get admitted. So if you counted all people who present to the ER for syncope, obviously not 1 in 6 is going to have a PE. These is admitted patients who were selected because of, for some reason, we didn't feel comfortable with discharge. So it's some kind of data that you have to take with a grain of salt. However, in terms of my own practice, if I'm admitting a patient for syncope, I'll probably have a lower threshold, work them up for PE. Even if they're not tachycardic or hypoxic, I would probably go ahead and scan them as part of the admission workup based on this study. I'm not going to change the diagnosis of a 20-year-old who passes out after standing and band, but certainly I'll do it on a 70-year-old who's getting admitted for syncope. So that's that.
Thank you.
Yay! For other high-quality medical education videos targeted at students, professionals, nurses, paramedics, go to ED Exit Video Pro and subscribe.